Self-medication is one of the serious factors that is causing deterioration in illnesses. In fact, it has become the order of the day in our area here and also in the whole Ghana that anyone can get up, go to any pharmacy or drugstore, get any medication and just start taking it. If we compare that to the countries around us, in fact, we are just a stone throw from Ivory Coast. You can't just get up and walk into any pharmacy without prescription to get medication and buy. The same thing happened in Togo. I've had the experience that if you walk into any pharmacy, they will ask you, where is the doctor's order? But in Ghana, it is not like that. We all resort to self-medication, which is not good. And in fact, there are a whole lot of dangers associated with self-medication. How do you know that? Probably your headache is as a result of hypertension. How do you know that it's just a dehydration that is causing it? How do you know that you are eminently going to get a stroke or CVA due to hypertension? How do you know that it is malaria that is causing your headache? So that is why it's so important that we need to go to the health facility, get checked, do the blood works, then we identify the cause, then we give you the medication. But it is no good that we get up on our own and just go to drugstore, get medication for the symptoms that we have. It is causing a whole lot of problem, especially antibiotics. Anyone who has abdominal pain, he goes to the drugstore, get amoxicillin or penicillin V, and he is good to go, and he is happy with it. Not knowing that this antibiotics, the resistance is on the high. So many people have come to the hospital. They get tested, they needed antibiotics, and you do the culture, and all the medications that you use, and the bacteria are resistant to all of them. And that is so dangerous to our health system. So I encourage all Ghanaians and we the health workers, the drugstore managers, that self-medication, we should educate our people about self-medication, that there's a need to go to health facility before getting medication into our system. The dangers associated with self-medication are so numerous and they are clear. We have deterioration in common conditions that can be handled. For example, someone has malaria, a child has malaria, and this child is having diarrhea. So when the mother goes to the drugstore, he is given medications concerning the diarrhea, and that is it. They are going to take it. Then in a day or two time, then the condition deteriorates. The child, from common malaria or simple malaria, it can go to complicated malaria, where this child have to be hospitalized for long. And the complications, sometimes they are very bad, can lead to cerebral malaria, where the child will be having convulsion and the rest, and its associated complications that will follow. And moreover, let's say you have headache. You go to the pharmacy or the drugstore to purchase medication. You tell the person, I have headache. Then he take para for you. Yeah, regarding the dosage, I don't even want to talk about it, because most of the drugstores, they give underdose or even overdose, which can have serious consequences on our health. So you are giving para for headache. Probably your headache is a high blood pressure, where the drugstore they did not check to see. Then you take your para, you are gone home, then the BP keep rising and rising, and at the end of the day, what will happen? Complications can happen. You can have stroke, you can have kidney failure, and so many problems. So the dangers are so numerous. And I will appeal to the government to put out a policy that will regulate the activities of the drugstores. So those that are employed into the drugstores, they should also be trained on how to identify some of these common illnesses. They should be given, they should be asked to do some tests, at least simple malaria like RDT. The RDT test for malaria, it can be in a drugstore. They should check before giving the anti-malaria to the client. And if any client come with certain symptoms, they should be able to check the basic vitals. Like they should be able to check the BP. They should be able to check the sugar. Then when they identify is high, then quickly they should refer the client to a health facility, a nearby health facility. So there is a need to train those who work at the drugstores. Not just anybody should sit there and give any medication they feel that the client need. My name is Delphine Udese.